Hi guys, this is Dr. Neil Malden from the Western Veterinary Cancer Center, part of the Western Veterinary Specialist and Emergency Center located in Calgary, Alberta, Canada. I put up a video dealing with some very basic cancer terms that you may deal with, and I've had a couple of requests to perhaps break that down into more manageable chunks. So what I've done is pull out each set of definitions that I talked about in the longer Introduction to Cancer terminology video and put them in little bite-sized pieces. So watch them each individually, watch the entire thing, and be sure and give us feedback if you found them useful. Another question we get is, what is an oncologist and why am I here to see you? And so an oncologist or a veterinary oncologist is a doctor of veterinary medicine, so they've completed their veterinary program, who has advanced training in the diagnosis, treatment, and care of veterinary cancer patients. In order to call yourself a specialist or to be considered board certified, you have to go through a series of steps and you have to be board certified then by the appropriate veterinary college. For medical oncology, so medical oncologists primarily deal with patients needing chemotherapy, that certification body is the American College of Veterinary Internal Medicine, a specialty of oncology. For radiation oncologists, so someone who primarily deals with treating cancers with radiation, that board certification is performed through the American College of Veterinary Radiologists, specialty of radiation oncology. And so then that kind of begs the question, what exactly does board certification entail? And it's a multi-step process. The process of board certification in any specialty requires additional training after you've completed your veterinary degree. So you've gotten your DVM, your Doctor of Veterinary Medicine, and then you've decided that you want to go on and specialize in a certain branch of medicine. Then there's a process that you have to follow to go through that. So step one for most programs is to complete a one-year internship that rotates through multiple specialties. So internal medicine, radiology, surgery, oncology, dermatology. There's lots of different specialties, and most internships try to rotate you through as many as they can in a year. And the reason for that is they want to expose you to multiple different facets of specialty medicine, but also to give you a chance to be really sure that you're picking the specialty that you want as you move forward. Because it can be, there's almost a bewildering array of specialists now and subspecialists, and so you really want to try to be sure you're picking what you want before you get started down that pathway. Once you've completed your internship and decided on the branch of medicine you want to specialize in, then you will enter a focused residency training just in the specialty that's being pursued. Most programs are a minimum of 3 years, although they may be longer depending on the specialty itself, and then if you have any advanced degree aspirations to go along with that. So if your veterinarian decided that he wanted to be board certified in oncology and also have a PhD, well, that's probably closer to a 5 or 6 year program rather than a 3-year program. There are also veterinarians who are board certified in multiple specialties, which typically means that they have to complete each part of that program separately to get certified in each of those specialties. Most specialties have a research and publication requirement, meaning that you're mandated to perform original research in that field and then to publish that research in the appropriate peer-reviewed journal. And then the final step for any successful candidate to be board certified is to take and pass an examination that deals pretty much with all aspects of their chosen specialty. The nature of the exam will differ very much between specialties. A diagnostic radiologist is going to be expected to read CAT scans and ultrasounds and x-rays, whereas a radiation oncologist is going to be expected to do safety checks and calculations for radiation therapy and things along those lines. So each specialty has a core knowledge base that the certifying body thinks is required for you to know in order to be board certified by them. And that's really what the exam for each specialty tests. So if we look at what board certification entails, it's a multi-step process that takes a little bit of planning, a little bit of time to complete. If we look at the entire process, it's an undergraduate education to get into veterinary school. That usually will take you 2 to 4 years, depending on the program. Then veterinary school doctorate programs are all 4 years now. So you've got 4 years of veterinary school, then a 1 year internship, and then a 3 year residency. So all in all, it will take you 10 to 12 years to complete, and that's assuming that you do each step in immediate order, so that you graduated from veterinary school and immediately matched with an internship program, and then immediately went from your internship program into your residency. And then I guess the final question is, how do you find a veterinarian that's board certified? If you know that your dog has a heart problem and you want a cardiologist, or it's got cancer and you want an oncologist, well, are there resources out there to help you find a board certified veterinarian? And most specialties do maintain a database of board certified individuals. So if you've been board certified by a college, they will maintain a database that's usually accessible to the pet owning public. So for the American College of Veterinary Internal Medicine, so medical oncology, cardiology, neurology, lots of different specialties, they have a web address, acvim.org, and if you go there, there's actually a pet owner section, and find a specialist application that will let you enter your geographic data, and it'll find the closest person to you. Similarly, the American College of Veterinary Radiology maintains a similar database. Their address is acvr.org, and again, they also have a pet owners portion of that website. So thanks for watching. Like us if you like us, and if pass this video on if you know someone who's maybe struggling with some of these issues and needs a little guidance. And please understand that it's not possible for us to offer either diagnostic or therapeutic advice based on a patient that we've never seen before. And we'll see you next time.